Well, new figures for coronavirus deaths in the East Midlands suggest several hundred lives have been lost in our care homes and communities. That's in addition to the more than 1,200 COVID deaths in hospitals across our region. Our social affairs correspondent Jeremy Ball is here. Jeremy, another insight really, a grim insight into the scale of what's happening.
Yeah, Dominic, these latest figures have come from the Office for National Statistics, and nationally they're starting to show us just how devastating this has been for care homes, with over 4,000 deaths of residents with the virus. But we're also getting a more detailed picture of what's happening here in the East Midlands too, and today we've been given these figures for the week to April the 17th. Almost 500 people died with the virus here in the East Midlands, very slightly down on the peak the week before, but it took the total number of COVID deaths in this region to over 1,400. Now, that's over 500 more than those numbers we already knew about from hospitals.
So why are the new figures so much higher?
Well, the real difference is that today's figures cover the community too. Nationally, we know most of those deaths are in residential care. Some of them are in people's homes. Worth saying, there's one caveat here. The areas these figures cover aren't identical, and that's partly because your local hospital might not be where you live. But I think they are really starting to paint a picture of the wider impact here in the East Midlands.
So how much is that affecting the overall number of deaths, that is COVID-19 deaths and non-COVID deaths?
It's really pushing the overall numbers up. We now know that over 1,600 deaths were registered in this region during that week in April. Now, that's more than twice the number for the same week the year before. Around a third of those deaths were registered as caused by COVID-19, but actually that doesn't account for such a large rise. So real questions being raised now about the reasons. Might it be partly because people are avoiding hospital and dying of things like heart attacks? Might it be because of delays in these death registrations? Could more people who are struggling be taking their own lives, for instance? Or could it simply be that COVID-19 is causing more deaths than we realise?